a month. So, and you have to do that for 2 years, and then you can get on some of the help, the Medicare. I made still too much disability to get Medicaid, so Medicare, but then the prescription costs too, which right now I'm paying $115 a week for pain medication. It's over $500 a month, so I've been buying it a week at a time. And the cancer has advanced. It's gone from breast to covering a lot of the bones now, which they give me a life expectancy of maybe 8 to 10 years, and I'm just getting done with 3. So, you know, hopefully they're coming up with new drugs and new things all the time. But in the meantime, you have to worry about the cost of how to pay for these things when you're trying to struggle with the health problems themselves.
Ellen, you said you'd been on both sides. As a nurse, had you seen this from the perspective of watching patients lose insurance and then worry about how they were going to continue whatever treatments and interventions they needed?
Yes, I've watched this over even the last 20 years. Did a lot of home health nursing, went into homes with people, and had a lot of, especially elderly Medicare age people that would decide whether they were going to eat or take their medications, you know, or would split a pill in half and make it last for 2 days instead of 1, in order to make it go a little bit further. So yes, then they would end up in the hospital as being sick because they didn't take the medications right, not because they didn't want to, but just because they couldn't afford to. So yes, I've seen this coming for a long time.
You know, when Ellen was told she no longer had a job, that meant she no longer had insurance. That's why, under my plan, I'm trying to break that linkage. You should always be entitled to insurance, whether or not you are employed, because people go in and out of jobs. You know, sometimes it's because of what happened to Ellen. She couldn't work any longer. Sometimes it might be you change jobs, and you know, the new job you go to, they have all kinds of requirements before you can be eligible, and maybe you get sick before the coverage kicks in, and then you're without insurance. Sometimes it might be that you know, your company just picks up and leaves, and you don't have any insurance anymore. There's a lot of reasons. That's why what I'm proposing is that it's your insurance. You know, we're not going to have things like COBRA. We're not going to have extra costs attached. You're going to be able to keep your insurance, and we're going to provide health care tax credits, and your health care costs will be limited. The premium costs will be limited to a relatively small percentage of your income. And if you still can't do it, you'll get more help. Because it's so important that everybody be covered. Because when they're not covered, I think it's both a real moral rebuke to our country. You know, I feel that really strongly. But it's also economically counterproductive, because those costs do get absorbed. Somebody has to pay for the care that eventually is delivered. You know, Ellen, when you are facing those prescription drug costs, are you now on the Medicare prescription drug program?
Yes.
And are you in the donut hole, as they talk about it?
Well, no, actually, I pay a little higher premium so that it gets covered for the complete 12 months, so I don't go through the donut hole. But then I have to pay a higher premium to avoid that donut hole.
What's your premium for your drugs a month? Do you know?
$179.
So it's $179 a month for the premium. You pay the $100.
Yeah, for the supplemental insurance.
The supplemental insurance.
Yeah.
You know, I was talking to a family here when I was here a couple of days ago, and they were telling me they had a small business, and their small business has 25 people, and one of their employees has just been diagnosed with a very serious and expensive disease. And the insurance company wants to raise the cost for everybody from about $600 a month to $1,200 a month to cover the cost for the employee who is sick. One of the problems is that in small businesses, if you are just one person out of 25 or even 1 out of 100 and you get really sick or you have a chronic condition, that increases the cost for everybody, and oftentimes businesses will say, well, we can't afford it anymore. And then all of a sudden you have 25 people who are uninsured because we can't afford, and there's a good reason why it's hard for the companies to pay for it. So again, we're going to have small businesses get extra help through healthcare tax credits also, because I'm not going to require small businesses to provide health insurance, because too many of them are right on the edge and they're on the margin, and 80% of our new jobs in the last 7 years have come from small businesses. So We don't want to interfere with what small businesses are creating. But on the other hand, we've got to get everybody covered. So we're going to give more encouragement and financial help so that small businesses are able to afford that. But I really want to thank both Pam and Ellen for telling their stories. I mean, it's not an easy thing to sit up in front of you and do this, and I think they both did an excellent job, and I'm very grateful. What I'd like to do now is have questions from all of you. Yes, sir. Here comes a microphone.
Dr. Kozlow, I'm a vascular surgeon and the president of the American Diabetes Association here. First, for Pam, I actually specialize in small vessel disease, and I'd like to offer you a free consultation. And
Thank you.
I was at a national meeting of the American Diabetes Association last week, and I heard a horror story from my hometown of Queens, New York. I'm an Iowan by choice, as I tell you.
Me too.
And an 11-year-old boy whose family did not have health insurance. And he was lethargic and having trouble with school. And then one night the parents did not take him to the doctor or to the emergency room because they did not have health insurance. And he lived in Queens. And one night he lapsed into a coma, was brought to the emergency room, and had a blood sugar of 1100 and died before the morning. And you know, these are the horror stories that S-CHIP right now would avoid. And I specifically want to ask you, what can you do between now and when you take the oath of office to get S-CHIP?
Well, Doctor, first of all, thank you for your offer to Pam. It really means a lot to everybody.
Thank you.
And we will make sure that you two connect after this is over. And your story about the young boy is unfortunately getting more and more common. As I said, 18,000 people die because they don't have health insurance. This is putting a story behind the statistic. His family didn't have it, therefore they didn't seek help, and the consequences were so fatal for him. S-CHIP is something, as I said, I helped to start back in 1997. I think it has done an enormous amount of good. You know, we cover about 6 million children. It's the Hawkeye program here in Iowa. Some of you know about that. And I've met so many people across Iowa who have been helped by it. And a lot of working parents who can't afford it themselves, it's their lifesaver because they know they can take their child to the doctor. I mean, just think about it. Suppose you want to play sports and you have to have an exam and you don't have insurance and you don't know anybody who will give it to you. Well, if you have the S-CHIP program, you can get that done. You know, a lot of times parents are afraid to let their kids even participate in sports because they're worried they'll get hurt. So this really affects people's quality of life, and particularly children's. So when we passed S-CHIP in '97, it was a Republican Congress, which we were able to convince to work with a Democratic White House, and we got it done. But they put in a provision known as a sunset. In other words, after 5 years, it had to be reauthorized to make sure it was working and it would continue. So I was in the Senate then, and we were able to reauthorize it, but we couldn't add any children. So we had 6 million children covered, nearly 6 million, and 9 million without health insurance. So once the Democrats took over the Congress, we began working with our Republican colleagues, and your two senators, Senator Harkin and Senator Grassley, were leaders in this. And it really brought the Senate together, and we worked to see whether we could expand it to cover more children. Now, in order to do that, we had to find more money to help pay for our share of the federal government's costs, because the way it works is the states put in